For 50 years, we have been dedicated to supporting lasting health change in Africa. Our mission and long history of working with communities has been possible thanks to your unwavering support and partnership. Your care and investment over the last 5 decades have ensured that millions of people have access to healthcare solutions that are community-owned and led, innovative and sustainable, and most of all, fit for purpose. Your support has fueled our initiatives, enabling us to partner with communities to ensure access to life-saving and essential healthcare services where they're needed and when they're needed the most. We now know that a new disease emerging anywhere is a threat everywhere, but we also know that people supporting people is a force for change that knows no bounds. With your continued support, we will be able to build on the progress we have made working with communities. Thank you for the 50 years of support. Together, let's continue supporting community-led health solutions for generations to come.
Good afternoon, good evening. Welcome to today's webinar on Africa shaping her own health future, the next 50 years. My name is Ryan Wiley. I am the chair of the board of Amref Health Africa in Canada, and I'm delighted that so many of you have been able to join us today. I want to begin by acknowledging where I am. I live in Takaronto, which we more commonly call Toronto today, and it's a Mohawk word that means where the trees stand in water. This land is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And today, this land is home to many diverse First Nations, Inuit, and Métis peoples. This land is governed by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. And we are visitors on this land, and we are grateful for the privilege to live, learn, work, play, and heal here. And as a settler, I recognize that the privileges I enjoy today reflect the careful stewardship and incalculable sacrifices of the original Indigenous inhabitants of this land. We have much to learn and much to remember if we are to avoid repeating the mistakes of the past and rebuild respectful relationships with the land and with each other. And I am personally committed to this work. And now I want to review with you, before we get into today's full agenda, a few housekeeping items. First, I encourage you to use the chat to introduce yourself to the other participants in this gathering. Today's webinar, I should also note, is being recorded, and we'll share a link with you after the event because we welcome you to revisit the content and certainly would love for you to share it with colleagues in your networks. We also invite your comments and questions, and so please use the Q&A chat function in Zoom to share questions for the speakers at any point. And while unfortunately we probably won't have time to address every question, I'll try to pose as many as I can to our speakers during the Q&A portion of our discussion. Just to set the stage, I want to offer a few comments. Amref has been in Canada for a remarkable 50 years. And today's event is an opportunity for all of us to reflect on the Canada-Africa partnership in health, to celebrate the impact we've achieved together, and more importantly, to discuss the future. What are the opportunities and solutions within Africa that will shape the next 50 years of partnership? How can Canada continue to play a constructive and meaningful role in realizing lasting health change across Africa? And as Amref Canada looks to the future, looks to the next 50 years, we are excited to welcome new leadership to guide us toward this future. Our new executive director, Navin Singh. Navin brings a wealth of experience in international development, partnerships, fundraising, and we're thrilled that Navin has decided to bring his vision, creativity, and ambition to Amref Canada. And we'll have a chance to hear from Navin a little bit later in this program. And before I introduce our first speaker, I want to share just a little bit about me. I'm a scientist, an immunologist specifically, and I now lead an advisory firm that works with healthcare innovators across the globe. So I've dedicated my academic and professional career to working with stakeholders and clients to create the future of healthcare. And it's exciting, it's enormously fulfilling work. But I also recognize that the healthcare future I'm helping to create is largely driven by the agendas of the global north. And that's why I'm so passionate about Amref. As the largest Africa-based and Africa-led health charity, Amref is committed to empowering Africa's health agenda. Amref's mission goes well beyond closing healthcare gaps. Amref is helping to create an ambitious, sustainable, and equitable healthcare future with, by, and for the people of Africa, especially the children, youth, and young adults who will build a new African century. And no one is better positioned to discuss Amref's vision than our first speaker, the inspiring Dr. Githinji Gitahi. Dr. Githinji Gitahi, as many of you know, is the group CEO of Amref Health Africa. He's held various positions in the health, media, and private sectors, and has many notable achievements, including his work with Universal Health Coverage 2030, Africa's COVID-19 response, the Africa Center for Disease Control and Prevention, and the Coalition for Epidemic Preparedness Innovations. He's a vocal advocate for universal health coverage and leads the largest convening on the African health agenda. Githinji, we're so delighted you've joined us today. Thank you.
Thank you very much, Ryan, and for this introduction, and thanks colleagues, thanks everybody, thanks everyone who has joined this session, and I wish, as Ryan has said, to thank you for your continued support of our work in Africa for the last 65 years, since 1957, when we were founded in the borders of Kenya and Tanzania, countries that have kept great friendship with Canada in the many years, and of course, many other African countries. Right now, we are serving over 42 countries in the continent of Africa, largely working with governments and the communities to bridge the gap that exists between the communities and the health system. And these gaps are not necessarily financial. These gaps are not necessarily geographic. These gaps are gaps of literacy, cultural norms, social norms, where women have to talk to their husbands or male counterparts to seek care. And these gaps also have to do with affordability and economic empowerment of different groups, where especially women have larger gaps because of their low economic empowerment, low land ownership, low access to capital. So this is the situation in which we are working. But let me just remind you very quickly a few numbers, that Africa as a continent carries 17% of the world's population, but it carries only 3% of the world's economic value, of the world's global economy, 3%. So basically, you can say that for every 17 people, there are 3 apples to share. But if you look at other countries, you look at North America, you're talking about probably 25 people sharing 4 apples. Or no, 4 people sharing 25 apples. But in Africa, you have 17 people sharing 3 apples. So you can tell from a resource point of view, there's already a challenge. Now, put within this challenge a growing population. Today, probably 125,000 children will be born in the continent of Africa. That is the registered births out of the continent. But out of these, we have major challenges. Some of those challenges have to do with, number one, access to health services. And those health services are basic health services: water, sanitation, nutrition. And these are compounded by increasing challenges like conflict, as you've seen in many countries in West Africa, where there's recurrent coups. Secondly, drought, Climate change now, where global warming is actually increasing vulnerabilities of communities with water scarcity, challenges of growing food. In all this, I want to remind you that therefore, when a child is born today out of the 125,000, in Africa, their chance of survival to 5 years is low. Only probably 70% of the children born today will get 5 years. 35% of them will die. But where are they going to die? They're going to die of preventable diseases like malaria, diarrhea, pneumonia. And these are not just diseases. These are conditions that are created by the conditions in which they live. For one, women are less likely to be enabled economically for them to take care of their families. And this results from, number one, traditional norms that disempower women to actually decide when to have their family, how big a family for them to have, because we have certain cultural norms, like, for example, female genital mutilation that happens in many communities, like the Maasai, the Somali, and the communities in Somaliland, and these across the continent. If you look at countries like in West Africa, we will have, in West Africa, you're going to have some countries that have up to 70% prevalence of female genital mutilation. Now, this leads to early child marriage, and this leads to dropping out of school, and this leads to less and less women joining the workforce. And this affects women in millions, and therefore it disempowers them from their decision making. Number two is, remember that within the same context, we have very low health financing. In Africa, the government put probably a maximum of, on average, $40, $50 per person for health services. In Canada, that number is close to $5,000 per person per year. That's public money. So this is more than 100 times what African government put. And you expect that these communities will need to access the same services. Without these disparities, Amref Health Africa works with governments, communities, to ensure that we increase community participation, community-led solutions to health services, and to ensure that actually we are not providing them a fish, we are working with them to increase their ability to fish, their ability to empower themselves and to make decisions on their own health. That's why we work with community health workers. We work with religious leaders to ensure that we can actually empower communities and inform them. And this is what we do with about 2,500 staff over the continent of Africa. We appreciate your support, because without your support, especially your unrestricted support, we are not able to make the decisions that the communities themselves desire. I thank you most sincerely, and I thank our colleagues in Canada for continuing to engage you and continuing to ensure that you have a chance to make a difference in Africa and to help Africa determine its own future. Congratulations on 50 years of Amref Health Africa in Canada, and thank you, Ryan, and your team for your leadership. Thank you very much. I sign out now.
Thank you so much, Githinji, for those inspiring remarks. And thank you for taking the time today to be with us. I know you have an extremely busy schedule, and we really appreciate your partnership and your support. So thank you so very much. Again, we are joyfully marking 50 years of Amref Health Africa in Canada. And I want to take this moment just to express my heartfelt gratitude for the pivotal role each of you joining us today has played in our journey. Through your unwavering support, whether as a dedicated partner, an institutional funder, a forward-thinking foundation, or a compassionate individual donor, you are the cornerstone of our success. Your donations have directly saved lives by funding critical community health programs, focusing on maternal health, sanitation, and disease prevention. And your support has enabled us to implement evidence-based practices, foster collaboration, and deliver sustainable health solutions, resulting in lasting health improvements and shaping healthier futures for generations in Africa. And few are better positioned to speak to the impact your generosity has helped Amref Canada to achieve than our next speaker, Dr. Florence Temu. Florence is the country director of Amref Health Africa, Tanzania. She brings over 17 years of dedicated leadership service to Amref Health Africa, a rich background in public health, and a commitment to improving health systems and health outcomes for communities across Africa. And we are thrilled to have her share her expertise as the newest member of Amref Canada's Board of Directors. Flo, over to you.
Thank you so much, Ryan. I also joined Githinji to congratulate Amref Canada for attaining 50 years of existence. And I must say, Tanzania being one of the first countries for Amref since its establishment, we are part of that history. And I can cite of recent things that happened in Tanzania. To date, we are proud to be among the people who can celebrate the results that we see in the country. And this is not so different from other countries in Africa, but I'll be citing mostly in Tanzania, where we had a number of interventions from Canada through Amref Canada, but supported by Global Affairs Canada, but even other private givers through private and private-public partnerships. So I'll cite, we have interventions that we address both on the demand side and the supply side of the healthcare system, and citing, placing in example here, we are looking at a program that we did in a remote place in Tanzania. You can Google and find where Simiyu is in Tanzania map, and you can tell that's one of the sites we've been implementing this support from Canada, but also Geita is also a remote site. And back in 2012, we had this program which lasted for 4 years, where we introduced intervention on accelerating and improving maternal and newborn and child health services in Simiyu region. And this is a time when Global Affairs Canada was known as DFATD, but we managed also to improve access to health services to a population where health services, even access to that was difficult, not just infrastructure, but even knowing, awareness raising, etc., was a challenge. So by then we raised from 58% to 70% of utilization of health services. But then 2017, up to 220, we got additional funding from the same sources through Amref Canada again with different partners. And this time also we addressed infrastructure issues on the supply side, improving maternal health services in having maternal wards with very respectful environment, but also availing health facilities where you also have operating theaters, so as to bring up comprehensive emergency obstetric care. This is to do with the late arrival in health facilities in complicated deliveries like obstetric labor, but we have health facility in the neighborhood where I can undertake safe delivery through surgical interventions. But not only that, we also integrated with water supply, because water is very important in terms of having quality services and health facilities, particularly maternal health care. And again, most of the people that we reach when it comes to sexual reproductive health are the young people, and they hardly come to health facility because of the environment. So we also train healthcare providers, not only in surgical skills or healthcare service delivery, but also to become youth-friendly and providing youth corners where young people can be free and attended with the youth-centered approaches. So this is just one of the examples, but through this arrangement, we are given opportunities to work in consortium arrangement, to come up with the community healthcare workers models, but also building on result-based management approaches, gender mainstreaming, environmental sensitive kind of intervention, because also have to take care of the environment, and most of all, women empowerment. And through this, Tanzania, we are proud with many other partners of recently just announced a drop in maternal mortality from what we call 556 maternal deaths per every 100,000 live births. Now we are recording 104 deaths of maternal death out of 100,000 live births. Canada has been one of the significant contributors to this outcome. I'll stop there for now. Thank you.
Thank you so much, Flo. It really is inspiring, the story you've shared and the really multifaceted, integrated impact that Canadian contributions have been able to achieve in partnership with communities in Tanzania. So thank you for sharing those stories with us today. I'm very pleased now to turn to the next item in our agenda, which is a panel discussion with two amazing individuals, Lolem Ngong and Bitania Lulu, who are joining me now. And I'll just quickly introduce them before getting into the discussion, but I'm really looking forward to the next 15 or 20 minutes, and I'm so grateful that they've joined us today. Lolem Ngong is a seasoned global public health professional with more than 15 years of leadership in health diplomacy and coordination of strategic partnerships to address threats to public health. And Lolem now serves as Chief of Staff at Amref Health Africa. Bitania Lulu is an award-winning global young leader who has been playing key roles for youth inclusion in leadership, policy, and decision-making processes. She's currently the program director of YACT, Youth in Action, which is Amref's regional program for youth-led policy, advocacy, social accountability, and capacity strengthening of youth organizations. Lolem, Bitania, welcome and thank you for joining us today. I want to start with a question for both of you. I'd like both of you to speak to, and I think it's a question that probably is on top of mind for everyone in this webinar today, and that's, why are you optimistic about the future of health in Africa? Lola, why don't I start with you?
Sure. Thank you, Ryan, and good morning, everyone. It's really a pleasure to be here, and that's a great question to start with. Maybe I'll highlight, I'll just speak about two things. I mean, I'm optimistic, one, because we're seeing a lot of strong commitments coming from African governments. Yes, we still have a very long way to go, but there are some really good, strong commitments coming from African governments on Africa's health. The one I would highlight, which we saw play out so well during the COVID pandemic, was a few years prior to the pandemic, the establishment of the African Centers for Disease Control and Prevention. And as most of you would know, during the pandemic, that institution really became a lifesaver for the African population. Their leadership, ensuring that PPEs got to several African populations, really mobilizing governments, mobilizing heads of state to put health at the center of everything that we do. Prior to that, yes, I mean, health was sort of an afterthought within our political establishments, if you will. But having the Africa CDC gave us hope, gave us optimism for what can be possible when we have very strong public health institutions, not just regionally, but also nationally. The second one I would highlight is a really strong, and when I say commitment in this, let me not say commitment. I think there's very strong evidence for the need to have us just sort of rethink our training and provision of healthcare workers. And we've seen a lot of support for that. People realizing that we can make all these big declarations on, primary healthcare and getting to the last mile and so on, but we can't do that without health workers. Now, we know there's a shortage of health workers really in so many parts of the world, but, we're really taking this very seriously and not only looking at health workers, doctors and nurses, but also really focusing on community health workers and harnessing that power of community health workers to deliver health services within their communities, to be able to create African solutions that work for their communities. I'll highlight just those two, Orion.
Great. Thank you, Lolem. That's fantastic. And Bitania, same question to you. Why are you optimistic about the future of health in Africa?
Thanks, Ryan. I'll start with Africa's growing youth population. By 2030, people under the age of 35 will make up of 75% of the entire population in Africa. And that is a great resource that we have. And tapping this great potential really poses a great opportunity to bring lasting health and development changes in the continent. And I find hope from the great passion and determination of young African leaders who are fighting their ways into decision-making spaces to really contribute to a healthier Africa. And young leaders in technology and innovation are also bringing new ways of solving community health challenges, and that really gives me hope, which takes me to my second thing that I'm excited about, which is African communities' resilience. We've observed that a significant number of tangible and sustainable solutions are community-owned. And as African-led health organization, Amref is very intentional about placing the community at the center, and people-centered interventions that are stemming from the resilience displayed by African communities and addressing health changes serves as a very profound source of inspiration for me as well. Last point, maybe, our ability to unite as human beings in general to solve global health threats with which was made very evident during the pandemic, as Lolem mentioned as well. And this interconnectedness resulted in increased collaborations between states, different actors, and public-private partnerships. And this steered interventions in digital health for adequate health information and service delivery. So African leaders also and communities are joining hands in health advocacy efforts to strengthen systems in Africa. So youth, community, and our ability to unite.
Thank you, Bitania. A great response. And I note that both of you mentioned the importance of homegrown or community-led solutions. And Lolem, I'd like to explore that a little bit further with you. Why is it so important to invest in homegrown, community-driven solutions?
Yeah, I think I will start from just something that's very basic, which all of us believe in, which is trust, right? So the trust you have, the trust you place in a person or an institution or an organization really fuels you to consume products. I mean, even if you think of, our preferred brand of, I don't know, laundry detergent, there's a certain element of trust that is built through advertising, and that makes us decide whether we're going to use, Tide or Downy or whatever. In the same way, when we talk about homegrown solutions, there's a very strong element of trust. Why? Because the people who provide and create those solutions live in the same environment, understand the context, and can relate, whether it's through language, verbal language, whether it's verbal cues, whether it's body language, whether it's, taking a solution and just sort of adapting it to the local context. For me, really, that element of trust really is where we start from, So if there's a solution that's brought to me and I don't quite understand within my context what it's supposed to do, or I don't really understand how it was created, and more importantly, if I had no input into its creation, how can I trust it? So homegrown solutions are extremely important because you already start with critical elements of trust.
Mm-hmm. That's so important, Lolem, and certainly whether it's in Africa or elsewhere in the world, we've seen how the absence of trust in scientific institutions and innovation has really hampered our ability to address public health. So thank you for making that very, very important point. Bitania, I want to turn over to you now as a representative of youth in Africa, someone who's leading programming to support youth action in health. I'd like to, and also given that, as you've noted, Africa has a very large young population, which is a huge advantage and opportunity. How are young voices, young innovators, young women being engaged and empowered to shape and drive the continent's healthcare future?
I think I'll start with sharing my journey in Amref and how I, as a young leader, have been engaged in shaping policies and programming in Amref. When I started with Amref Ethiopia, I was chairing the Youth Advisory Council on volunteer basis, which was a platform that was created to build for youth, a framework for youth and adult partnership to ensure that young people are engaged from agenda setting all the way to implementation and monitoring and evaluation. That gave us space to really co-create different projects, one of which is the Integrated Youth Activity or CAPITA project. It's a $60 million investment, 5-year project that started in 2021. And it was really co-created and owned by the young people. And it has a very integrated approach of health, education, and economic empowerment for youth as an entry point for health and SRH interventions as well. And young people are built in coalitions at city level, regional level, national level to really ensure that they're engaged in agenda setting and advocacy efforts in their countries, even beyond health. And we also had a youth empowerment fund that was set up to fuel innovation and technology of youth-led solutions for community. We also target diverse youth with 50% of that fund ensuring that goes to young women, and 6% to youth with disabilities. And we also had a very interesting literacy and numeracy impact in youth that have not been able to go to school in their time. That really helped them to come to par with their partners and really perform as leaders, see themselves as leaders in their community. So those are the different ways that we used in Amref Ethiopia. Now I can also share the YACT model, which is a regional advocacy platform. We have one project that really steered cross-country learning between youth-led and organizations and young leaders across 21 countries with online digital advocacy and social accountability platform. And nationally, we have a teenage pregnancy project. And we managed to push for the implementation of postnatal return to school guidelines for teen mothers and the adoption of our meaningful youth engagement framework by Kenyan parliaments. So that really empowered teen moms. After we capacitate them and link them with economic empowerment opportunities, they can now envision themselves as change makers of the future. So it's multifaceted. You have to engage young people through advisory roles, but at the same time, engage them throughout the process of program design, implementation, and monitoring and evaluation so that they can be active change makers and an integrated and multi-sectoral approach.
Thanks, Bitania. And I just wanted to build on that last point that you're making and maybe explore a little bit further. Given your experience with YACT and other initiatives, what are some of the most powerful strategies or tactics to support youth engagement in Africa, in health specifically?
What worked in our models is first capacity building and investing in youth leadership. And that is backed by intergenerational solidarity. So we're not just empowering young people, but also preparing the community to accept young leaders as leaders of their community. So intergenerational solidarity. And the second one that I already mentioned is the integrated approach of health, education, and particularly economic empowerment of youth is also a great promising tactic to really empower young people. I've already said that we need to engage young people in agenda setting and design and implementation, but also multi-sectoral engagement, including the private sector and different partners for the health and well-being leadership of African young leaders. Yeah.
That's great. Thank you. And I love the point around the importance of taking an intergenerational approach to youth empowerment. That's really, really powerful. Lolem, I want to turn it back to you and sort of thinking about sort of global collaborations that are needed to drive the African health agenda moving forward. And Canada, as we've heard, has been a very, very active supporter of health change in Africa over the past 50 years. But what does that future partnership look like? And how can we be as powerful and impactful as possible?
Yes, Ryan, this is a difficult question, and I say it's a difficult question because, I think part of the formula that we don't need to tinker with is really ensuring that we have these multi-sectoral partnerships. I think that's just part of the formula that's standard. Now, the challenge in as you know now and as we look ahead is, how does that then operate within a really drastically changing ecosystem? So whether you're talking about economic crisis, whether we're talking about some of the nationalistic views that we saw during the pandemic and a little bit during pandemic control times. I think that's our challenge. Now, my take on this is, we can still continue this sort of multifaceted collaboration if we sort of diversify the partnerships and look at a really healthy mix of different types of partnerships. And what do I mean by that? I'm saying, if, government, we've certainly as Amref received significant funding from the Canadian government. We've also received funding from foundations. I mean, MasterCard being one of them. And then there's the piece of other sort of private sector funding that adds to that diversity in funding. And most importantly, and Githinji hinted at this, was, just around unrestricted funding. Mm. And I think that combination then gives us this really sweet spot of being able to really fund programming that will make an impact on Africa's health development agenda. That way, we're able to be creative as well and innovative in different ways to reach the community, or even in funding some of the capacity building that Bitania talked about, to ensure that our young people are really taking ownership of their own health solutions. They're designing their health solutions, taking ownership, and leading those health solutions. So when we have this really good mix of multi collaboration, different types of partnerships, we're able to then fuel that change that we want to see. So, I think the formula is the same. It is collaborating. Mm-hmm. But the part that we can do better with is ensuring that that collaboration and the actors within that collaboration are quite diverse.
Thanks, Lolem. That's really, really helpful. And I just want to, before I go into my next question, I want to remind our audience to please share questions in the Q&A function of Zoom. We welcome your comments, your questions, your ideas to add to this discussion. But I did want to ask a follow-up question, Lolem, more broadly with respect to sort of global health financing mechanisms, which have evolved over the past several decades and have diversified as well. How have global health financing mechanisms, whether supranational entities or large foundations, how do they contribute to this work? And how do you see their role changing moving forward?
Mm-hmm. I mean, quite frankly, when you look at the data on development assistance, right, we can't help but ignore the fact that there is a significant portion of development assistance that comes from these very large global financing facilities. And those funding facilities have also been very instrumental in pivoting the trajectory of some of our disease trends. One that we're all quite familiar with, the Global Fund for one, PEPFAR for one. I mean, these are instruments that came about at a time when we couldn't imagine that, we would have ARVs for AIDS. We couldn't imagine different innovative ways of preventing HIV or providing care and treatment for HIV. And so those financial facilities have provided the fiscal space for us to be able to, on the African continent, where in some countries, 1 in 4 people were HIV positive, they changed that trajectory, right? Where there was, just gloom. I mean, you couldn't imagine that somebody could, live for forever and ever with AIDS, but then those facilities changed that trajectory. The same thing with Gavi. There's so many countries, particularly on the African continent, where the majority of Gavi's funding is excuse me, allotted to African countries. And that has changed the trajectory when we speak about child immunization, which, as you know, immunization is one of the basic pillars in the delivery of primary health services. So these global health initiatives, finance initiatives, are extremely critical because we have so many examples of where they've changed that trajectory. Now, do they need to change? Will they change? I think, will they change? I'm not sure I can answer that question. Should they change? Yes. And I say that because, there are I think some of the members of the audience now probably do, through their tax dollars, indirectly contribute to these facilities, right? I mean, the Canadian government does contribute to, the Global Fund does contribute to Gavi. So should they change? Yes, because there's so much around us. The health agenda or the development agenda is so dynamic. I mean, right now we need to think about the effects of climate on, vector control, right? So do they need to pivot to help address some of these different impacts on health? Yes. So we can't be too siloed, because now there's so many other things that are affecting health. Health interventions are no longer as simple as they used to be. So when we talk about, treatment of or malaria control, now we need to look at what are those other environmental factors that will affect, incidence of malaria, and what do we do to mitigate those? Which means we probably need to look a little bit into, climate. Will those facilities fund climate? Right now, no. So that shift needs to happen because health is also changing.
Mm-hmm. Thank you, Lolem. Excellent point. And I want to turn now to some additional questions that are coming into me, and maybe I'll bring a Flo into this discussion as well. So, Flo, if you can turn your camera on, and excellent. So one question that's come up is with respect to the role of philanthropy, and we've certainly been touching on that, and I think we recognize that philanthropy is critically important to this work. But I wonder if we can just take that a little bit deeper and just understand what role does philanthropy actually play in this work, and maybe provide an example of the power of philanthropy to achieve lasting health change. Who would like to start?
I could start off with an example, and I'm hoping Flo would come in with a strong example of walking, because that's a great community-grown solution. Philanthropy really plays a massive role in pivoting what we're able to do in health. I'll give an example of a gift that Amref did receive from Mackenzie Scott. And that gift has allowed us to do so much more than we could have ever imagined. I'll highlight 2 things. One, it allowed us to provide technical assistance to African governments, specifically ministries of health, and to civil society. And just to make this maybe make it more meaningful, and it's very simple things like distribution of health guidelines, which For some ministries of health, that was impossible, or donor coordination, which is extremely important. So the flexibility of those unrestricted gifts that come from philanthropists allowed us to create solutions and just gave us that space to create solutions that were meaningful for several African countries. And this was through technical assistance, like I said. That gift has also helped us build our university. I mean, we've always had Amref International University, but the gift has allowed us to give the university more space to operate instead of being crowded or really limited in the courses we teach or in the equipment or in the cadre that we admit into the university. The gift actually helped us become more creative. So that is just a small illustration of how effective philanthropists can be.
Thank you. That's an outstanding example. And Flo, I think you have an example as well.
Yeah, I can add to that. Actually, one thing is to understand that philanthropists have the spirit of giving, and we should value that spirit. And results should motivate them. So we, on the receiving end, should be able to produce results that one sees the value of the support that they've given us. So one example is to share that the spirit of philanthropy or the practice is not that significant in our settings, but at least there's some element that we can build on. The example that I will cite is not necessarily unrestricted, but at least it was a giving from individuals, from the corporates, from different people within our settings. And this happened in Zanzibar, where we mobilize people from different corners of the world, whether within Tanzania, outside Tanzania, to support a cause. And this is about supply of medical equipment for safe motherhood, for safe delivery. And the president of Zanzibar volunteered to be the guest up to now. So we've done that the last 2 years, and we're anticipating last year and this year, we're anticipating to do again next year. And it's not just giving, but also we show the results. So people provide in kind or cash in the same cause, and we support the health facilities to be equipped with the right equipment. But on top of that is to promote the skills and life-saving skills for the healthcare providers, inventory management, but that also has the support of the Ministry of Health. So we come together as partners, us as Amref, but Ministry of Health, private sector, individuals, international collaborations that we have, but also the president himself being there, and we demonstrate by walking, and the walking means walk, jog, run for the same cause. So end of the day, we are going to account for that, and we keep informing our supporters. So to answer your question, yes, they play a great role, and we encourage people to continue to support. The only thing, the task that we have is to make sure that we account for results and also show changes. We should not remain where we are when the initial funding was given. We should show change in the community. If we're talking about safe delivery, facility-based delivery, we should show where we came from and where we are, and sustaining where we've reached.
Thank you, Flo. And Bitania, did you want to comment on this question as well? Great.
Yes, I'll add my 2 cents and very briefly. WIACT was formed because of philanthropy, actually, because of the funding that we received to create something that is purely youth-led and youth-owned. And it was started in 2017 as a Kenyan initiative that was, that created, it was like an incubator to ensure that we have what we call youth-led advocacy. What is it? What is policy influence? What are the priorities that young people set for themselves? And now it has expanded to a regional program. So philanthropy definitely plays a great role in creating such initiatives and expanding them. And because of the WIACT model, now we've impacted over 60 youth-led organizations that have been capacity strengthened through our program, and now are able to, fund their own fundings and resources to continue the work that has been started. So it's really important that these philanthropist initiatives are, fueling the creativity and youth leadership that we need in the continent, but at the same time, it's the ripple effect is also seen in other organizations that are sustaining the work in the communities.
It's amazing. Thank you, Bitania. And a couple of other questions have come in that I think are important to discuss. We've used the word sustainability a lot in this conversation today. And the question from the audience, and I'm sorry I don't have the name of the person who posed this question, but how do you ensure continued sustainable interventions at the community level that can be transferred to community ownership aimed at enhancing lives beyond the project funding timeline? Who would like to tackle that? Lolem, I think you I have a feeling you have an opinion.
Yeah, I can provide a brief response. So I think maybe from the conversation we've had so far, the examples we've shared, even with just listening to Bitania's sharing with us a brief history of how WIAC started and how it spread, is that I think that the thread that's common there is that, these are they're homegrown solutions. And if you remember in the beginning, Githinji said, we work through communities. So what's really important is that those homegrown solutions and working through communities already builds in a sustainability factor. So even if the initial funding is through donors, we do try our best to ensure that by working through communities, those remain sustainable solutions. Because the one thing we know is that when communities believe in the solutions, communities do become creative in sustaining those solutions. For example, right now we have these mobile clinics that were they were funded to provide, to move around the community and deliver COVID vaccination or administer COVID vaccinations. But of course, because of WHO's declaration of the pandemic being under control, we have expanded those to do basic screenings for non-communicable diseases, and that was at the demand of communities. So now the mobile clinics go out, and there are all these screenings that are done. But what ended up happening is, in some of the counties in Kenya, pressure from the community and then also local government is that it's also being used to sensitize populations on social insurance. How do you sign up for social insurance? Where do you get social insurance from? And then the local governments also putting in their own funds to take on ownership of the mobile clinics. And because these are run by community health workers, or community health workers sensitize populations of where the clinics will be and so on, the community see value. And also because you don't have to go really far to access that health services, because it comes to you, whether at church, in a market, at school, whatever, then the community sees the value of maintaining that service. So that's just an example of how sustainability is built into those solutions, excuse me.
Thank you, Lolem. And I think you've also helped to address another question that has come in through the chat regarding how you encourage African governments to fund health-related projects after the funding from international donors has expired. And I think that you're really speaking to that point. We're really out of time for this discussion, unfortunately. But I don't know, Flo, Bitania, if you have a 10-second observation to make on this question before we wrap up.
Yeah, I think much as we talk about partnerships, community should also be one of the partners. Communities as partners, not mere recipient of services to wait to receive, but they should be listened to. And we have this, what you call the cultural norms that we kind of condemn them, but it's an opportunity to turn those cultural norms as positive opportunities that we can build on. Like example, female genital mutilation. When we introduced this intervention, people had their own priorities. They wanted water, and we are telling them to stop cutting. But when we introduce water in conjunction with the female genital mutilation, then becomes alternative rite of passage, but they can also have access to water. We've already addressed the need and what the community wants. So I think is we should also need a kind of creativity around there, but engage them 360 degrees, not just to one end for one purpose, but also addressing some of the core community needs integratively. Thank you.
Okay. Thank you. Excellent point.
If I may add for 10 seconds.
Okay.
Co-creating with communities is very important. We shouldn't just go with our interventions, but co-creating these solutions will make them community owned and sustainable even after we have phased out in our projects. And that has proven true in different projects that we have in the youth programming in Amref, including the teen pregnancy awareness that we do with YACT and the different policies that we co-developed with county governments here in Kenya at the grassroots level, and with the intergenerational dialogues that have really developed the awareness level of the communities, also their acceptance and buy-in in the agenda. So yeah, co-creation and co-ownership.
That's great. That's a great way to end. Thank you, Bitania. Thank you, Flo. Thank you, Lolem, for being with us today and sharing such rich and diverse perspectives on these topics. Really a privilege to be with you today. So thank you. And I'm now going to turn it over to our new executive director. This is week 2 for Navin Singh. Welcome, Navin. Welcome to the team, and welcome to Family Amref. Over to you to close us out.
Thanks, Ryan, and thanks to all the panelists, and thanks everybody for joining us today. I hope you found the conversation inspiring and insightful. And as you can see, Amref will be close to the work of shaping Africa's health future for the next 50 years. And we hope you'll journey with us in that. And as you know, Amref Canada is celebrating its 50th year of partnership, which is an incredible milestone. And to mark our 50th anniversary milestone, we saw it fitting to celebrate this moment with a special funding opportunity. We're actually hoping to raise $50,000 by our birthday celebration date of May 30th. And I'd like to ask you if you'd consider making a birthday gift for this work. The great part of this is that the board and board alumni of Amref Canada will match your donation, so your gift will have double the impact. So I want to thank you again for attending this panel discussion. Thank you to all our panelists. Watch for a link to the recording, and I hope you all have a wonderful day. Bye, everyone.